This is part 1 of the recording on documentation. What are some elements of documentation? Well, the content is important, and documentation must reflect the nursing process. You want to document observations, not what you think you're perceiving. You have to document nursing interventions, the patient response to it, all medical visits that you see. When you call about questioning a questionable order, make sure you document that too. Always use standard terminology for your facility. Check your spelling and grammar when you're writing a note. Or I should say typing a note in the computer. It is a legal document, so you will be held accountable for everything that you put on that patient's chart. So, characteristics of effective documentation. The Joint Commission states that all nursing care provided must be a permanent part of a patient's record, with nurse practicing or nurses practicing according to policy of the facility and their professional standards. Get your charting done as soon as possible. If you can document in the patient's room, that's going to be better for your patient in the long run. The provider will have your information to look at, sooner rather than later. And, make sure that you document everything that you do. Poor documentation can affect patient outcomes and, put you as the nurse in a questionable position of your credibility. And if you would ever get called in for a lawsuit, your documentation is your best defense. And confidentiality, as we know that patient confidentiality is on the next slide. So let's talk about HIPAA. Most everyone in healthcare is familiar with HIPAA. Patient data is so much more easier to access by more than with just those that need to know. So we have to ensure, we keep our passwords secure, log off the computer screen, not leaving patient information exposed so anyone can see it. Sending email through a confidential network or faxes. And what rights do patients have? Well, let's find out on the next slide. So they have all of these rights. One right they do not have is to make changes to their health record. They cannot do that. And if an institution wants to release a patient's health information for purposes other than treatment, payment, or routine healthcare operations, the patient must be asked to sign an authorization to have their information released. So why do we keep records on our patients? Well, facilitate patient care. All disciplines can communicate through the record. Clinical research can be used with documentation. Administration reviews records, which can help with cost savings. They might find something is not cost effective and make a decision to get rid of that item. Students gain access by reading patient's chart and learning from the content. And of course, the Joint Commission and CMS have their requirements as well. Their standards that facilities have to follow. The majority of facilities are on electronic health records of some type. I know some students each semester, at least one or two, have stated that where they work, they're not yet. But I know it was by a certain date that everyone had to be electronic or they would have to pay a fine. So I would just think there are so many advantages to electronic health records. I cannot imagine ever going back to paper. And I guess that would be one disadvantage, is when things shut down that you have to go to paper. And that would be a shock to the system.